Good afternoon, everyone. It is 2 o'clock now, so we will begin. So welcome everyone to our Ealing Health and Wellbeing Board. As you know, this is the first board of 2025, so perhaps it's not too late to say Happy New Year to everyone. And welcome everyone on the Teams online as well. We've got quite a busy agenda this afternoon, so we do need to keep on time and be as succinct as possible to ensure that we cover all of the agenda items. I'm not going to do a round of introductions to save time. Just to say I'm Dr. Vijay Taylor, I'm the Vice Chair of Health and Wellbeing Board. I just want to give apologies to Peter Mason, the Chair of this board, who unfortunately is not able to make it. Right, just want to check a couple of process matters first. So if there are any urgent matters that we need to address, please could you inform us at the front desk. Declarations of interest, apart from the ones that have already been noted, is there any other declarations of interest that we need to note for this afternoon? Nope, great, okay. And are there any matters that need to be considered in private? I haven't been notified of any, so that is absolutely fine as well. And then the last meeting was on the 12th of September, and the minutes have been distributed. Anyone got any comments or any amendments or any additions onto those minutes? Are we all happy with those minutes? Are an accurate reflection of the meeting? Great, thank you very much, everyone. Right, okay, so let's move on to the first substantive item, which is the North West London ICP Joint Forward Plan. And this is a refresh of the existing plan. And we've got Faisal to talk us through the main salient points, and then we'll open it up to questions.
Sorry, it's my first time here. So hi everyone, for those who don't know me, I'm Faisal Patel. I'm the Head of Strategy for North West London ICB. I'm here on behalf of Toby Lambert, our Executive Director of Strategy and Population Health. So this year I led on the development of the ICB's Joint Forward Plan, which, just as a reminder, is a statutory requirement that ICBs need to publish on a yearly basis in collaboration with their NHS partners. So the joint refers to the ICB and their NHS provider partners. I won't present the plan in detail, just mostly because of time, and hopefully you have seen the latest draft. But I can take you through some of the context behind this year's plan, and it would be really great to hear comments and questions on the content of the plan before our submission deadline, which is March 31st. So happy to take comments here, but would also be very happy to take comments offline following the Health and Wellbeing Board. This year, as Vijay said, we made an intentional decision to do a very light touch refresh of the JFP. So hopefully you've seen last year's JFP, which had 9 priorities. And this year we've got the same 9 priorities. They've just been slightly reordered and themed in a slightly different way. But what we've focused on this year is the actions that sit within those 9 priorities. And this was done intentionally for a few reasons. Firstly, we've been through an organizational restructure. So there's a lot of movement between teams. And we're also expecting the NHS 10-year plan to be published soon. So we thought it best to kind of keep the refresh relatively light touch. As I mentioned, we focused on the actions within those 9 priorities. But this year you'll also see a greater focus on our integrated neighbourhood teamwork. So this is all about integrating health and social care and bringing care closer to home and providing more proactive approaches to delivering care for our most complex patients. We're expecting the NHS 10-year plan to be quite focused in this area as well. So we're hoping to see some alignment there. I'll also list some changes that we plan to make based on the plan over the next few months, because we've got ongoing strategy projects. So urgent care strategy work is still ongoing. So once that's complete, in the next month or so, we'll see some of that latest thinking kind of feed into the next draft. We've also got various work packages related to integrated neighbourhood teams, so hopefully we'll have more detail on that in the published version as well, and we'll also see a lot more kind of detail behind our elective care strategy. So kind of underlining the government's commitment to hit the 92% 18-week RTT target. We've got our planned care strategy work ongoing at full speed at the moment. So once that's ready at the end of this financial year, we'll have more detail to add into that priority, which is priority 9 in the document. So I won't go into the kind of the detail of the plan, but very, very happy to take comments and questions from the board.
I'll open up to questions from anyone on the board and also online. Polly?
That's the thing. Thank you, Chair, and thank you for that, and welcome to your first Health and Wellbeing Board here at Ealing. It's very long, isn't it, the report?
Yeah, it is, although it is shorter than last year's.
90 pages at approximately 9-point font. And there's lots of good stuff in there, but there's a lot of stuff, as we often see, that describes the challenges that we have.
Yeah.
And then obviously the real challenge is what we do to then really make those changes stick. I don't think, and it's perhaps, I think the area around the integrated neighbourhood teams is kind of going to be our priority interest at the moment, and NAHAR is grinning, because I think that's where we can, in terms of our partnership, really start to think closely about that and add value. And I know that conversations have already been had.
Yeah.
I guess the concern is that yet another reorganisation of the way in which you work, and thereby how we work with you, inevitably has that sense of not fatigue, because we're obviously enthusiastic partners, but you've also been through your own reorganisations internally, and there's a lot of change, and obviously we're awaiting the changes that we'll see as part of the 10-year plan for the NHS. Do you expect a lot of this to be kind of sideswiped by the changes that we might see in the 10-year plan or the consultation that's happening, or do you expect it to be very much in line? And my second question was really around the way you summarise the productivity challenge, and it's great that that lower cost base with high levels of productivity compared to other ICBs. You're still looking at lower productivity before COVID, and seeing those very high numbers of staff, but not seeing the efficiencies and outcomes that we might expect from the wider, very good work that's been put into the plan. So I'd love your comment on both of those, please. Thank you.
Thank you. Shall I respond now? We're expecting the 10-year plan to be very much aligned with the priorities outlined in our joint forward plan, and we're keeping close to the consultation on the work that's going on in the national team, primarily through Penny Dash, who sits on our board and is also part of various working groups within the 10-year plan programme. So we're hoping to see a lot of the integrated neighbourhood teams work that we've described, very much kind of core to the 10-year plan. And we're expecting to see similar kind of actions against the planned care work as well, and kind of reducing inequalities and having a standard core offer across the patch. We're expecting it to be very much aligned, but obviously there's still a lot more work to do in the 10-year plan, and the publishing date of that keeps getting pushed back. So that's all we can say at this point, really. On the productivity point, so yes, absolutely, we do kind of benchmark well on our productivity metrics in comparison to others. That being said, as you mentioned, productivity has decreased since the pre-COVID period. We're trying to understand exactly what's driving those, and we have external support at the moment, kind of going through a very kind of rigorous kind of productivity analysis and recovery plan process. So we're hoping to see the results of that work in about 6 to 8 weeks' time, and we'll have more to update on that as and when concludes.
Kerry?
Thank you, Chair, and thank you, Faisal. I'm going to repeat some comments that were made with the North West London DASs earlier in the day. There's an ongoing concern from my perspective, the statutory DAS in Ealing, in terms of the inequity in terms of funding coming through the ICS, and the plan doesn't clearly set out any definitive approaches and strategies for the high levels of deprivation in Ealing, the greater levels of health inequalities that are experienced by residents and patients in Ealing, or the fact that we're a net importer of people into care homes into Ealing Borough from the inner London boroughs. And it's disappointing. We've been talking about this for some time with colleagues at North West London. Levelling up seems to have fallen off the agenda in terms of funding for the outer London boroughs, and it's something we'll be feeding back before the closing date of the consultation. Thank you.
Thanks, Kerry. Any other questions? David?
Thank you, Faisal. It's obvious that a lot of work's been put into this, and I commend you and your team for it. One thing that concerns me is how we engage with patients. Given the changes at the ICB, I know there's been changes to the NHS engagement team. What are we going to do to ensure that patients are engaged with in an equitable manner in the future? Thank you.
Really good question. So we do have some recent kind of bolstering of our comms and involvement team. So we've got some new joiners who will hopefully be able to kind of make sure our kind of communications and involvement program is robust. Generally, we do quite well on an engagement basis. We have a number of engagement dates in the diary on a regular basis, like residence forums and kind of listening events and community events, particularly around equity as a specific area of focus. We've got kind of various community in-reach programs in train. The Joint Forward Plan itself has been published on our website, and we're seeking comment from the public on kind of what they think of the plan and whether they think it kind of adequately meets the needs of them and their communities. And we also do quite a lot of engagement with patients on a case-by-case basis. So our planned care strategy work is currently in train, and we're just about to launch kind of a public engagement program specific to planned care to really understand kind of how patients feel about the waiting times that they have, how to make those waiting times feel a bit more kind of how they can wait well, rather than just kind of wait 18 weeks and not hear from the NHS until they actually have their appointment. So we're doing a lot of work on engagement on a case-by-case basis as well.
Simon, I think you got your hand up. My vision isn't great, so I think it's you, isn't it, Simon? Yeah.
It is. It doesn't help against the yellow background. I appreciate that. So apologies, but yeah, it might be a bit counterintuitive for some, but as someone who clearly representing the acute trust, local acute trust in Ealing, but obviously also in Brent and Harrow, absolutely support the emphasis on community service provision and also the levelling up issue that Kerry talked about. London North West used to provide community services. I know the processes we went through over several years in terms of tendering for those services, a disinvestment that has taken place over the years. We absolutely need to redress that balance. If we want the integrated neighbourhood teams to work, there has to be that investment in the community services in terms of the number of staff. The reason I'm not there in person today is I'm on call, and the demand that we've got at our front door, both at Ealing and both at Northwick Park, is unparalleled, I think, in terms of my 12 years as part of this organisation, and we're seeing it routinely in terms of in terms of number of patients waiting in both A&E departments for extended hours at a time, and that's after we've already placed patients who need an admission, taken them up to a ward where they're waiting for a bed on the ward. They're on a trolley, they're waiting for a bed, and you know, we have patients in the corridor through the A&E department waiting to be taken into the A&E to be seen. So, yeah, we can't solve that as an acute trust. That can only be resolved in the community by a different level of service. We could possibly solve it by opening many more beds, but we wouldn't have the staff to service them either. And I would make the point that mental health as well, the number of mental health presentations we're seeing coming in from the community, again, over the last 5 or 6 years has gone up considerably, and routinely seeing every morning, probably on Ealing on average, at the moment, at least 6 patients waiting every morning, and at Northwick Park, probably of the order of 12. So absolutely support the concept of if we want the integrated neighbourhood teams to work, they will only work if they've got the right community service provision running alongside them. And as Kerry has alluded to, there clearly is a mismatch for the ICB to address in terms of the level of investment versus the type of demand across the 8 boroughs in North West London.
Can I respond to that? Absolutely. We're definitely prioritising this levelling up agenda across our community and mental health services. There's actually a lot of work happening aligned to priorities 4, 5 and 6 in the joint forward plan to work out exactly what community services will sit within our kind of core contract across North West London, and what services will be needed to be bespoke to specific boroughs. We don't have specific answers yet. There's a lot of work still to be done. But hopefully through this work, we'll be able to level up our services and level up spend and investment in line with demand across the footprint.
Chris.
Sorry, Kerry, I think I may have jumped the queue.
We've got similar jumpers.
Thank you. I just wanted to comment as the provider of community and mental health services, and having been familiar with this document both through the BBP and its development and through the work with the collaboratives of the community and mental health trusts, that it welcome the content and welcome the engagement into the content. Just to echo the points really made by Simon and Kerry, there remains a challenge around the levelling up agenda and making sure that we can ensure that residents of Ealing are able to expect the same level of service that we have in some of the other boroughs. I just wanted to counsel against the assumption that all of those changes can be delivered through productivity alone. Mm-hmm. Within West London Trust, we've been working really closely with the ICB on a programme of work known as True Up, and that True Up looked at the level of activity that was being delivered before COVID, the additional investment we've received over the last 5 years, and the investment and the activity that we're delivering now. And there is no productivity gap for mental health services or community health services in Ealing when looked at through that True Up lens that the ICB have delivered. So the assumption that any additional work, I mean, of course, we can always work more productively, but the gap in Ealing is not going to deliver the additional services that we aspire to deliver here. So that's where the levelling across and levelling up agenda is going to be particularly important for our communities. Thank you.
Thanks, Chris. Kerry, did you want to come in now?
Thank you, Chair. 2 points. First one relates to David's questions about the engagement and just looking for assurance, Faisal, that the documents available in the various community languages that the population using Ealing. And the second is more of a point and not wanting to keep grinding away at this axe, but Ealing's got 10% above admission rates into acute hospitals above the North West London average. Chris's point, Simon's point, and the points that we're making is that if the funding doesn't reflect the need in terms of the deprivation and diversity of the community in Ealing, we will continue to see higher levels of admission, which just puts increased pressure on colleagues within acute trusts and diverts resources away from healthier communities, which is in line with the Health and Wellbeing Board's strategy and also the ICB strategy. So two separate points, but
yeah.
Thank you.
I'll take the first one first. So on the languages point, so the plan itself is right now only published in English. I will look into whether it can be published in other languages prior to kind of our final publishing deadline of 31st of March. That being said, a lot of the information that feeds into the plan has been based on engagement events and additional types of engagement that we have done on a face-to-face basis through kind of additional languages and kind of other programs of engagement that are, you know, slightly more detailed than the engagement we might have done for this joint forward plan. So a lot of the information feeding it is based on quite robust community engagement. Yeah.
This is not engagement if we're not publishing these papers in the community languages.
Okay.
In Ealing and other boroughs.
Okay.
We serve very diverse communities, and in order to hear the voices, we need to have effective engagement.
Okay.
I'm not saying that you haven't in the face-to-face stuff, Faisal, but
Yeah.
we need to engage with those communities to ensure that their voices and their needs are represented.
Absolutely. Agreed.
Yeah.
Thank you. So, Faisal, thank you for all of the work that you've put into this, because I know how much you have done for quite a few months now. And you've got there's a page in here about the Ealing work, and I just wanted to make that connection with the work that has gone on up until now in the borough-based partnership. This is that is continuing, and it aligns really well with the priorities, the 9 priorities in here. So it's not a great big change for us as a local borough-based partnership, but the most critical thing is it's fantastic that we're getting the feedback into this document and all of these comments up. I agree with everything that everybody is saying. It's what we do with this and the action plan over the coming year. And although we say this is a health partnership document, I just want to reflect that actually health can't do this on its own, because some of these things that we've been working on have been really closely with our local health and care colleagues, our voluntary sector colleagues, and our local residents as well. And by pulling our collective resources together on our shared commitments and agendas is the only way we're actually going to make a difference to that. So in the future, we could think about how we bring more of the local things back to the Health and Wellbeing Board, because we've done it in the past, but there's always something to continue to bring back once this has been finalised and we've got some of these questions answered. But I just want to do that connection with that local piece. Thank you.
Thank you, Dan.
Thank you very much. Now, just a general comment from me, Faisal, in terms of a joint forward plan like this, which is over 5 years. You know, clearly this has been written on the backdrop of the financial challenges that we face, and often in these plans, it becomes more aspirational rather than a reality because of the financial constraints. And so one needs to make sure these plans have a level of flexibility and they adapt in relation to the environment that we're trying to work in. So that, I think that's really important. And in terms of the borough-based partnership slides, the individual slides within the pack, I think in a plan like this, it's important to try and put some level of timelines in some of these priorities that are being described at the moment. There are just primarily headlines. But I think in terms of putting some sometimes to these priorities gives us some level of reality that when they're going to be achieved as well. Great. Okay. So thank you very much, Faisal, for coming along this afternoon. Great. Okay. So let's move on. So next we've got the BCF quarter 2 return. After, do you want to come to the table? Welcome.
It's on. Lovely. Right, so this is just a very quick update on the quarter 2 submission for the Better Care Fund plan. As part of the national conditions, health and wellbeing boards are required to have oversight of the health and wellbeing, the BCF plan, but also to review progress against the plan as well. This is a mid-year point review in terms of progress that we've made against the expenditure plan, our targets, but also in terms of our assumptions around demand and capacity. It is a key requirement against the national conditions. The template has been submitted on time, in line with the conditions as well, and it's attached to this report, and it effectively goes through a number of key indicators and components which we have to update on. The first is confirmation that we have complied with the national conditions. I can confirm we have met all these national conditions, and that includes our expenditure and our targeted activity across the partnership is focused on independence, so keeping people for as long as possible in their own home and providing the right care at the right place at the right time. There is also a national condition around the NHS minimum contribution, one to adult social care, but second to the investment in the out-of-hospital services. We have complied with the minimum contribution and we have confirmed that in our submission for the quarter 2 template. The template also provides an update for our key performance indicators, which is aligned to the national BCF objectives. We are on target for all of them at the midpoint review, but there is a slight concern with the falls indicator. When we set out the plan in September of last year, our falls indicator was based on the premises of the public health outcomes framework. The data that's been published since does not correspond to that, so we cannot be assured that there is any significant compliance with the falls indicator. So what we know locally is different to what's been published nationally. There's probably a slight difference in the definition and the way it's been captured. So we have not submitted data against the falls for quarter 2, and we'll wait until we've got further assurance around the differences and we can assure ourselves locally against our progress. The template also provides updates regarding our expenditure midpoint as well. On the whole, we are on target. A lot of our expenditure is based on staffing for the local authority in terms of our key services, reablement, social work, placements, but also some of our key contracts that we have within the community. We have a significant spend within the adult social care discharge grant. That is expected because that's just a contribution towards the cost the local authority incurs through the discharge process, and we will probably spend in full by quarter 3 of this year. We also have provided an update on the demand and capacity in terms of what our assumptions were when we first set up the plan to what we are now experiencing in terms of on the ground. There is a slight difference, and that's due to data captured across North West London, the Optica data, and what we are seeing locally in terms of our activity. An audit is currently in place to verify the data, and through this validation process, we will be able to formalise a much better understanding in terms of what our demand and capacity is. This is just a quarter 2 update. It's part of our key duties we have as part of the Health and Wellbeing Board to review progress. Please bear in mind that we are currently in the process of actually submitting a quarter 3 template as well. So there tends to be a delay in terms of when the templates are published and when we can submit, and the timing of these reports. The deadline for the Q3 template is going to be the 14th of February as well. But we hope to submit a report at the next appropriate Health and Wellbeing Board. It's also worth noting, and I would be remiss not to mention that there has been a North West London BCF review, mainly on the additional contributions. A task and finish group has been set up to understand what the implication of the review is. There will be no immediate changes, but as soon as we know more about the BCF review and the impact it has across Ealing, we will come back to its Health and Wellbeing Board and present our findings. Any questions?
Thanks, Avatar. Questions from anyone? Kerry? Polly?
Move this over here. Thanks so much, Avatar. It's less of a question, and given that it's just a Q2 update, I don't think we need to labour the BCF too much. But again, to echo your comments, it would be remiss of me not to reiterate just how important this fund is, and being able to fund these joint endeavours with the ambition of enabling particularly safe and hospital discharge, and to really support the reablement work that we do is really crucial to the work that we do. And any review that didn't take that into account would be disappointing, and we look forward to seeing what that brings.
Thanks, Polly. Kerry?
Thank you, Chair. I think just a couple of points. The plan for 25-26 is potentially could become problematic in terms of timescales, and we need to be aware as a Health and Wellbeing Board what that means in terms of process, and if timescales, which are getting very tight now, are not hit, we will be lobbying from an adult social care perspective to roll forward on the current arrangements into 25-26. I think, and going back to Nehal's point earlier about the importance of us working together, the outstanding work around the bridging service, which was developed within the partnership to support colleagues within the acute trust, and the improvements that's seen in terms of flows, especially for P1, pathway 1 patients, is a really good reflection on the work that we do as a system in Ealing, and I think that's really important to be heard here. And lastly, I'm back to my old funding issue. Ealing's one of the most deprived boroughs in North West London, and we received the second lowest funding per head of population via the BCF in North West London, and significantly less deprived boroughs are receiving almost double per head of population that we receive in Ealing. Thank you.
Yeah.
Thank you. Just building on just a couple of things. Avatar, in the submission, the Excel submission, it's not printed out properly on the website, of course, and some of those boxes are red, but I think that's because there was an issue with the actual template, wasn't it, that was nationally sent around. So I just want to assure everybody on that one, it's not that something was missed. But the other thing is, it's not just the review. At the moment, we have a number of schemes, which Kerry talked about, the P1 bridging schemes as well. So a part of the Better Care Fund that came through last year, year before, was some discharge monies that's helped system flow, that really support what Simon was talking about earlier about helping the flow of patients through the hospital, so that as patients come to the front door, they can get the care they need within the hospital. And this money is there to support that flow. And we've done a lot of partnership working to look at all of the different elements of flow, from mental health, supporting our care homes, supporting patients going home, or going home with a package. But we haven't as yet had the national confirmation for next financial year, but we should have it by now. But it's getting quite tight in terms of confirmation of what is going to be available next year, and therefore what can be committed and what the national process for allocations is going to be. So obviously we will bring this back once we've got that confirmation, but it is getting quite tight, and that does risk services as well, and staff that are running those services need that confirmation and comfort that they're going to have those roles going forward.
And that, yeah, and that, what you said now in terms of next year's funding, in terms of not having clarity around that, really does put our current schemes, our current provision, potentially at risk. And clearly there are some really important service lines within the Better Care Fund, which is absolutely vital. One, to support the system, but also in terms of support the residents in the community. So I think it's important that we do try and get that information and clarity as soon as we possibly can. But I do want to say that what the Better Care Fund has done for Ealing for a number of years, it's been a real enabler in terms of how that collaborative working between health and social care has been, and so much good work has happened through the Better Care Fund over several years, and it's important that we continue to strive. Taking Kerry's point around the financial differential, and credit to Kerry for constant, being a constant in terms of trying to bring that issue to the forefront in terms of that differential between the inner and outer boroughs, particularly for Ealing. Any final questions from anyone? No? Good. Thank you very much, Aftar. Good. After just one question I've got, and because obviously there's a time lag. This is quarter 2. We're actually in quarter 3 now. We're more or less going to be ending. Well, in fact, we're in quarter 4 now. So from a sort of visibility of the board in terms of the year end. So I presume, will you be coming back at year end now? It's quite difficult to understand.
Yes,
from our perspective, yeah.
So I will come back with a year-end report and some case studies around the impact of the Better Care Fund. The time lag is an issue. So, for example, the quarter 3 reporting template, the deadline for that's the 14th of Feb. So, halfway through quarter 4, and it's been a consistent time lag in terms of the planning, but also the submission of the progress reports. But we do come back to Health and Wellbeing Board at various stages. One, to sign off the Better Care Fund plan for any financial years, but also the submission of the end of year report.
Good, thanks for that. Lovely. Let's move on. We have the Ealing and Hounslow Community Voluntary Sector Macmillan project around cancer awareness, and we've got Anna Suarez who's here. So welcome, Anna.
And you can, yeah, okay. Good afternoon, everybody. I'll just do a quick introduction of this program and project that we've been delivering over the last 2 years, and then I'll hand over to Anna to deliver the formal part of the presentation. Just kind of by way of background context, we've been working with Macmillan since 2020 to look at their approach as to how they engage with communities, and to understand what the methodologies that they've currently used, which have been successful. And a lot of the work that we did was kind of during the COVID period. And then as coming out of COVID, we launched this new, essentially new way of engaging with communities with them. So it's been a long process in terms of developing an approach and then rolling the approach out. So this program of work that we've been delivering has been commenced in 2023, and it's looking to conclude in this year in 2025 in April. And it brings together a combination of what's worked well towards engaging communities and also coupling up with a community champions program. So really leveraging the voluntary sector capacity and capability towards volunteering and engagement with VCS organizations to improve some of the outcomes for those who are going through that cancer journey. Anna's been our kind of principal project manager on this program, so I'll hand over to her to go through the formal part of the presentation.
Yes, good afternoon, everyone. Thank you so much for having us today and inviting us to talk about this project. It has been an amazing experience in the communities, talking with the people, going there to the mosque, to the different organizations. They speak different languages, different cultures. We have been just bridging all kind of barriers just to raise awareness to everyone and connect with those people who are isolated. As Irfan said, that this project is sponsored by Macmillan Cancer Support, and this sponsor will finish in April. So we will terminate the project by April. One of the things that we would like also to say is about the project objectives. So it was about strain relationships with the local communities and improve trust and confidence in the services Macmillan can provide, reducing inequalities for patients diagnosed with cancer in the minoritized ethnic communities and marginalized groups. The objectives, we increase awareness of cancer, early screening uptake, and treatment and support services and how to access them for those affected with cancer. Provide cancer support and improve experiences, helping to build the trust not only in Macmillan but also NHS and all the services available in the borough. Address cultural issues and socioeconomic conditions. Macmillan has given donations as well to those cancer patients who are in need. We recruit the champions, and it has been very diverse group, 95 champions. They learn about cancer awareness. They learn how to support and connect people in their communities to the services available, which is something that adds a lot of value to the communities. Why we did that? So it's something that we have been discussing. Is Ealing is one of the most diverse boroughs in London, and we have almost 55% is ethnic community groups. And some of the ethnic community groups, like a Black background, there are some barriers that they hesitate to go to see the doctors. So we have been working to go deep to connect with those communities. We will give some case studies at the end. So another thing is the language barriers, culture barriers. Some people, they believe talking about cancer is not appropriate. They feel it's not a good thing to talk, but we have been through that. People has been more open to listening and learning. That is all only for our awareness. The other thing is the service delivery impact. So we have delivered 105 events in the communities. We have done 22 coffee mornings where cancer patients, carers, and relatives can join, and anyone, it was open. Always we talk at different types of cancer that were aligned with Macmillan Cancer Support. We have also cancer awareness talks, 56 in the communities. We have translations in different languages. Champions were very key in doing this, playing this role. So they were translating, having that one-on-one, because some people, they couldn't speak English, but they want to have that communication. So we managed to do it. And the other thing is, we engaged in different projects. Maybe you see me around with the stall and so on. So we did a lot in the Ealing Borough. The cancer awareness talks, we talk about different types of cancer awareness: breast, colon, prostate, cervical, uterus, lung cancer. So they are different, but we were more focused in the 4 top types of cancer. That is breast, prostate, colon, and lung cancer. Yes, we reached more than 3,500 people attend our events. It was gradually, so that is how we achieved this number of people attending. We also, through this project, we have building a lot of relationships with different community partners. Some community partners, they don't have emails. You can send emails and you cannot reach them. The only way to reach them is going there to the communities, talking to them, and showing value of the work that we are doing, which is completely free and was bringing a lot of awareness to the communities. And we have been working with them. We have worked as well with the clinical partners, 7, and we have 48 community partners, like in the communities and organizations as well. The demographics, yeah.
Just here some kind of comments on the service delivery impact. Those 48 community and voluntary sector organizations, these are now trained organizations which have people within them, whether they're staff, volunteers, they're service users, which have a good level of cancer awareness or knowledge. So if a service user or community member approaches them and says, I'm experiencing these symptoms, they should be able to direct them to kind of services, speaking to someone with Macmillan or speaking to any kind of the cancer helplines that are out there. So that's an incredibly important asset that's been created within these 48 organizations. And just on the Cancer Champions point, we had 205 volunteers express an interest on becoming a cancer champion. 151 cancer champions were actually successfully recruited and are on the waiting list to be trained. And of that, there's 95 active cancer champions in the borough, speaking in the region of 20 different community languages.
No, nothing. Is she on the line?
20 community languages, which hopefully represent the depth and the breadth that we've been able to recruit from in terms of the population Ealing. So hopefully every single community in Ealing is represented in terms of language, and that ability to translate some of the materials that we're working with and working within their own communities. So the way that we look at the Cancer Champions is that they are assets within their own communities. They go out and they engage in their own communities, whether it's in their faith communities, whether it's in their kind of families or social circles, just to spread that information about cancer and to reduce some of the stigma that's associated within more diverse communities around certain types of cancer. And the next part, which we just kind of want to touch on, is some of the demographic analysis around the communities that we've interacted with. So as expected for Ealing, our kind of goal was to reach every single kind of community which there was some level of ethnic diversity. Our largest cohort of service users has been from the British Asian population. So the Indian, Pakistani, Bangladeshi representation is made up about 60% of those engaging with our services or seeking information. One of the items which we found that even though we have a very large Arabic speaking population in Ealing, as well as ethnically Arab communities, only about 1% of our service users recognize themselves as coming from that ethnic background. So slightly underrepresented group there that we found over the last 2 years. And in terms of one of the areas which has become quite important for us is the South Asian and Afro-Caribbean challenges around prostate cancer, especially amongst men, and again, lower level of representation in terms of those participant groups. And generally the other ethnic groups which tended to interact with us, there was a small 7% of mixed ethnic backgrounds and 2% of any other white background. So there's still lots of work to be done to get to all of the communities that are affected by cancer. And it's not just the cancer diagnosis, it's that first stage of understanding do they need to approach health services? If so, which ones do they need to approach? How they need to articulate their symptoms, how they need to articulate some of the challenges that they're having, and going through that journey. Because ultimately where this started off was Macmillan identified that people from ethnically diverse communities have worse outcomes in terms of cancer from that point of accessing healthcare, the quality that they perceive that they receive from the system, and then ultimately that impacts survival rates, ability to keep interacting with their clinicians and get the treatment that they need. So that's kind of the core theme of where we're working from. In the presentation pack, you'll see that we have some feedback from the communities. The figure which we've got today, which is updated, is that now there's over 1,000 feedback surveys collected. So from the 3,500 resident one-to-one interactions that we've had with residents expressing some form of cancer concern, over 1,000 people have reported come back to us with feedback, which we are going to go through in this last quarter of the programme to provide our final reporting back to Macmillan. We'll be happy to come back to this board and share that final reporting to Macmillan, because it does represent a 2-year, quite substantial piece of work engaging with communities around this topic area. Overall, 70% of people who responded to the survey noted an increased confidence about accessing services, in particular Macmillan services, and they felt a little bit better supported and a bit more empowered in terms of where to go and what to do. I think in terms of the challenges, one of the challenges which we've experienced is that we want to make sure there's a balanced composition of cancer champions, making sure that everybody is well represented. And we have found that for certain types of cancers and certain community groups, there's an overrepresentation. So in particular, where we've got a high number of female cancer champions, we need to balance that out with male cancer champions as well, just because there are religious, cultural barriers which need to be broached when discussing certain types of cancers as well. And the kind of other challenge which we experienced early on was community partnership development is very challenging. It's very difficult where, as Anna mentioned, you've got organisations and community groups which don't have email addresses, work in more informal ways. It's really about building up trust and building up those relationships to say, you know, we are here, we're here for this period of time, we've got this information, this is how we can benefit your community. And it's one of those things where the places that we're trying to go to are the more dark corners where those communities may be suffering in silence or the information is not reaching them. So that community partnership development has been really important in terms of going out and making these new relationships, bringing organizations forward, bringing them into the fold, empowering them with information and knowledge. And that is all relationships and relationship building that's taken place over the last 2 years. I will pass over back to Anna now to take us through 3 case studies for this program.
I'm just sort of conscious of the time. Obviously, we've got quite a big agenda. Clearly, everyone's received the presentation and the case studies are in there, so they'll be able to go and reflect back on it. It's just if you could just sort of finally conclude what you'd like to say in terms of the presentation, because we really need to get to questions and then next follow on with the rest of the agenda.
I think Anna and I have covered quite a lot of it, so if there's any questions, happy to take.
Polly.
So I first met Anna, I think it was her very first community meeting at Southall Community Alliance, must have been back in 23. So I'm delighted that you've grown the project and seen so many successes. It's such crucial work, and it's hard work on the ground to get that partnership and participation from our residents. And it's obviously so crucial because we see such different outcomes in the support that people seek, and ultimately in the health outcomes of parts of our community. The case studies really bring it to life, so thank you for that. My question was really around the legacy of the project. What can be done more? I'm assuming the funding comes to an end in April, which is why you stop. Would you continue if you could? And how do we, I suppose, continue the work that those champions have been able to do and the hard work that you've done to establish them. But I really want to say bravo, Anna, because it's really good work, and thank you.
Thank you, Polly. Thank you.
I'll take the question about sustainability. So Macmillan has, so this funding comes from Macmillan. Macmillan has been re-examining how they fund organizations and the work that they want to do. Essentially they're streamlining. So they're reducing their footprint in terms of the funding that they give out. And so that has caused an impact on not just this Cancer Champions program, but every single one that they fund nationally. So for us, what we've been doing is we've been looking into having conversations with the National Lottery, and we're not delivering this program in isolation. There is a counterpart organizations in Brent and Harrow which are also delivering this. So essentially it's the work in Ealing ×3, and we're looking at tri-borough approach to the National Lottery to see what can be done. But ultimately what we've been able to do is establish a model and approach which can be adopted to other health concerns.
Great.
Thank you. I just wanted to ask, you said that you had a number of people on the waiting list to become trained. Just wanted to confirm that they will all get the training, or will there be a gap in people receiving training before the project ends?
For the Cancer Champions, if we can get all of them trained and get them through, we will, but ultimately there'll be nowhere to deploy them because the program will come to an end. So if they want the training, they'll receive it. But ultimately, with the Cancer Champions that we have, we're now having conversations with our counterpart organizations in Brent and Harrow to see if they can be taken on and essentially support the efforts which are still ongoing over there.
Kerry, did you have your hand up?
Thank you, Chair. And as Councillor Newstab said, this is excellent work and it really shows how to engage with communities. There's such a big opportunity here to link up the Cancer Champions with community champions and other community engagement pieces that we're involved in as a system. And I'll ask Ruby to take that away in terms of discussion with Anna Bryden, our DPH, in terms of how we can engage the whole system and pull all this resource into a more coherent structure.
Yeah, Ruby.
Fine, thank you, and Anna, for that. I just kind of echo, it's a really, really important area. We've got one of the lowest breast screening rates in England, so this is really valuable. My question is if the final report will come to the next board, maybe just to have a think, I guess from my perspective, I'm thinking what kind of marginal system changes can come out of some of this learning, because I think it's so crucial that you're speaking to the communities who don't often present or don't engage. But what do we need to do from a systems perspective to make it easier? So that's just my last point, and acknowledge just the conversations about thinking about the architectures around champions and how they continue. So there's a bit of legacy left. Thank you.
Yeah, I mean, I just want to reply to that. We've got fantastic, these volunteers are amazing community assets, and essentially with our program coming to an end, they now need a new home. So if there's any avenues which we can re-engage them and keep them within the system, whether it's health related or statutory services, we'd welcome those conversations.
Thanks. I don't want to repeat what others have said, but first of all, so thank you very much to Anna and Irfan for all the work you've done in it. And Macmillan, as we know, is a fundamental, essential charity nationally in terms of supporting individuals with their cancer diagnosis and living well with cancer, because cancer doesn't have to mean the end. You can continue to live cancer and fulfill your lives. But I do want to say finally that in terms of this piece of work and work that we continue to do, you know, we do know that in Ealing particularly, our early diagnosis of cancer isn't as good as some other areas of London and other areas of the country. We are still continue to see a significant number of patients who are diagnosed at stage 3 and 4. So, you know, all the work that we do collectively from a voluntary sector, from health, from social care, from the public at large in terms of how to recognise as early signs of cancer and then seeking support and help, and early on it's so essential and crucial in terms of making sure that they continue to live healthy lives. So thank you very much for both of you for coming along this afternoon. Okay, so we'll move on now to the carer strategy and the carers JSNA. And I think on the screen we've got Kashmir, who's come along with some carer colleagues as well.
Yeah, that's right. Hi, I'm Kashmir Thakur. I'm the Older Adults Commissioner. I'm presenting this item with my co-presenters. So I'll just let them introduce themselves. But before I do, apologies from one of the carers who are coming along. She has had to deal with an emergency, but I guess that just demonstrates the demands on carers' time and the fact that they can't always be where they want to be. So we've got Gule and Sadaf. Gule, do you want to go first?
So I'm Gule Hanet. So I'm a main unpaid carer for my 39-year-old sister who is paralyzed, has complex epilepsy, is deaf, has cognitive impairment. Unfortunately, my sibling brother passed away in February last year who had a similar condition. And from December last year, I've been also the main unpaid carer for my mom who's had a stroke. And my third family member is my father, who's 87-year-old and has got long-term condition, and also look after all three of them who live in the same household.
Thanks, Gule. And Sadaf?
Hi, my name is Sadaf, and I'm a parent carer unpaid for my daughter, who has got severe learning disabilities and complex health problems. She's 12 years old.
Thanks, Sadaf. So I'm just going to start with a little bit of kind of a background to the JSNA and the strategy. You do have all of the information in your pack, but just to start with a very quick snapshot of some of the data that the JSNA gives us. So according to census data, we have around 24,500 carers in Ealing. Of those 2,000, around 2,000 are young carers, and of those young carers, around 350 are aged under 16. There's always the caveat that census data and any recorded information about carers it's generally understood it's an underestimation of the actual number of carers, and that's for a whole variety of reasons, but largely because carers don't always come forward and self-identify as carers. What the census data does tell us is that the number of carers has gone down since the last census, but again, there's a lot of reasons why that might be. The impact of COVID, and again, people not coming forward and identifying themselves as carers. But while the numbers have reduced, the intensity of caring has increased. So what that means is that carers are doing more care hours than they were previously. So around a third of adult carers are doing more than 50 hours of caring per week. And that intensity of caring picture is also reflected among young carers. What it also does, some of the other data that the JSNA identifies is that there is going to be quite a significant projected increase in the number of unpaid carers in Ealing. So around, it's estimated that there'll be an increase of around 40% over the next 15 years. So the carer population is estimated to increase quite significantly. The JSNA also brings together data from surveys. So we have the Adult Social Care Survey, and we do score quite low on that survey of carers, particularly in areas where they feel consulted or involved in decisions about the person that they care for, whether they feel that they have enough access to information. So we are sort of consistently low on that score, and generally satisfaction with services. All of those are reflected in the consultation and engagement that we've undertaken with carers. The other important part of the JSNA, I think, is that it identifying the impact of unpaid caring on carers, particularly the impact on their physical and mental well-being, as well as things like loneliness, isolation, and the financial impact. And again, that is also reflected when we look at young carers. They're also facing the same negative impacts as a result of being an unpaid carer. The JSNA also brings together information around the policy context. So there is various bits of legislation that identify the obligations on us to identify, assess and support carers, and also the strategy aligns with the health and wellbeing strategy and local priorities around tackling inequalities. And I think what the JSNA also does is identify that carers are impacted by health inequalities as a result of the impact on their physical and mental well-being, their lack of access to services, and the financial impact on carers. So the strategy is based on those findings, the gaps and recommendations identified in the JSNA. The strategy builds on the previous strategy that was developed in 2018 and rolls forward the 4 priorities that were identified in that strategy. The feedback from carers was that those priorities are still important areas to be addressed. And those priorities are identifying carers at an early stage in their caring journey. So that's all carers, adult carers, young carers. Enabling carers to have a family and community life alongside caring. Supporting carers with to maintain their physical and mental well-being, and supporting carers to maximise their incomes and realise their potential. The strategy sets out a set of principles around developing a think carer approach, creating carer-friendly environments, and addressing inequalities, recognising those health inequalities that impact unpaid carers. The strategy sets a vision for supporting unpaid carers. That's identifying and recognising carers, making sure that carers are seen and heard, and that their needs are understood. The action plan identifies actions to deliver against those 4 priorities. What it aims to do is identify practical actions that can be taken by organisations across health, social care, voluntary sector organisations, employers. So it's an all-age strategy. It's being developed jointly across health, social care and voluntary sector partners, some of who are on the call today. What I'm going to do now is I'm going to pass over to Gule, who's going to talk about her own experience in relation to priority 1 around being identified as a carer, and some of the difficulties she's experienced, but also some of the positives that have helped her on that caring journey.
Yeah, so the implementation of a carer's card at Ealing Hospital helped me to be identified as a carer, and it gave me 24/7 access to the hospital and be part of the care given there to my sibling, hence resulting in a quicker discharge as I knew what the home setup was and I could identify what kind of seizures my sister was having, because in Ealing Hospital you don't have a neurology ward, and there are basic like internal medical doctors looking after complex epileptic patients, and it's really very difficult for them to identify seizures as well. So the carer's card enabled me to attend the hospital ward round where the doctors were present, and we made a quick decision as to a quick discharge and what the community planning could be on how to look after her. And also I could share my other experiences with them on what things work better for her and what don't work best for her. This card was fairly new to Ealing Hospital, whereas I've been attending it for 15 years and I'd never had this opportunity before. That's it, I think. Next.
Thanks, Gule. So Rosilla was going to talk about her experiences in relation to the second priority around enabling carers to have a family and community life alongside caring. The experience that she was going to share was her experience of having a direct payment, which she felt gave her a better kind of control over arranging care for her loved one. She also wanted to talk about how important it was to get information as a carer, but also how difficult that has been for her. Gule and Sadaf, I don't know if you want to add anything in Rosila's absence.
I think she was very thankful about the Carers Cafe thing. She really wanted to mention that
she did, yeah.
that Carers Cafe has been really good support for her, and she appreciated. Yes, and the training that she received for direct payments, because initially she was too nervous, but I think there was a very good support system. They guided her through, and it became like really easy. So yeah.
Yeah, thank you, Sadaf. Yeah, she did want to really emphasize the importance of having support with a direct payment, and that can be daunting for carers, but with support, it can be positive. So Sadaf, just handing over to you around priority 3, the support for carers to maintain their physical and mental well-being.
So one of that was that, but the other one, yeah, it was Gule.
So it was the group respite. So I found out about the short break services available at Ealing and learned a lot about the well-being programs, including the peer support and the social inclusion opportunities. For example, the carer cafes that are designed to enhance mental and physical health of the paid and the unpaid carers. And I also found out about the free training and workshops for the family carers available in the borough. For years, I had the hoist at home. I had never had the hands-on on how to use it, but this kind of training helped me to use the hoist more confidently. And we should note that we should always focus on the mental well-being and the opportunities to bringing carers together. And it is quite helpful for a carer like myself to attend these sessions.
And then priority 4, which is around supporting carers to maximise their incomes and realise their potentials. Sadaf, you were going to share your experience.
Yeah, so my experience with the short breaks is like, I never thought that I could earn. I thought my life revolves around caring and being a mother of 3. And then I always wanted to work. So the short breaks that they allow me to actually earn. So I dedicate that time of my respite to self-employed and flexibly work the way I want to. And when I feel fit, same time I get the opportunity to actually give my other children time. And it was one of the best services I received, the respite care. And other than that, I think family support workers from Contact Healing and MenCab, all those charities, and I think even Sandias, it has changed to, it used to be ISAID, all those family support workers, they have been a great support system and helpful for us parents, all are generally carers, because the forms filling sometimes it drains completely. They are very complicated, they're tedious, and they break you down emotionally. You remember and think about everything. So they were like the support, the technical language around it. So yeah, it is also positive in Ealing. We are very lucky that we have these charities and their family workers to support us with that. One thing I would like to take the opportunity to do mention as that the troubles and the challenges we still face and they're ongoing, and hopefully there will be something to be done about it. Is there is the uptake of the direct payments in the children's sector, like in the parents carers, is very low, and I don't think there is enough information out there. So it's still one thing that probably majority of us don't know about how easy it is or how it can be facilitated. The other bit is the transport and transport to respite for children or disabled um, um, individuals, because sometimes it takes a lot of the respite time to drop off and to pick up, and then it takes away that time from us, which is not that like it's not that in terms of it's not that useful, it doesn't remain that useful. So it seems like very little. If there's anything that can be done about that, that would be amazing. So, Kashmir, did I forget anything? I just
No,
you're very good at.
Thanks, Sada. Thank you. I hope that by sharing their experiences, it helps to understand that whilst there are challenges, there are positive examples of ways that we can support carers, and the aim of the strategy is really to build on what we're already doing, the good practice that is already exists across different organisations, and to share that good practice and learning, and really just to improve the care and the support that we offer unpaid carers. So happy to take any questions.
Great, thank you very much, Kashmir, and thank you very much for sharing your experiences. Often these experiences are so powerful in terms of, it brings some reality check to all of us in terms of what we're trying to do. Kashmir, before I open up to questions, in terms of the Ealing Carers Partnership supporting unpaid carers in Ealing, is there anything further you just want to add from that presentation? And then we'll open up to questions.
Would you like to take that presentation now? Would that make sense?
Yeah. We'll put them two together. So if you can just finish that off, and then we'll open up to questions.
Okay. Is it Sally or Karen? Are you?
Yes, it is. Yeah. Hi. There's two of us doing this. I hear your cry for short presentations, so I'm going to challenge my colleague to keep it really strategic. You've got the slides and there's a lot more detail in those, but we'll try and keep it brief. So I'm Sally Chandler. I'm the Chief Executive of Carers Trust Hillingdon and Ealing. I've been delivering carers services to carers of all ages for 11 years in Hillingdon, and about just over 12 months ago we put together the Ealing Carers Partnership in response to a contract that was out from the council to run the short break service and to really look at how we can support carers to have a bit of a life outside caring. So it was lovely to hear from the ladies about their experiences of that. So the partnership, so we've come in from Hillingdon, but we have a really strong relationship, and one of our core partners is Ealing and Hounslow CVS. So we're delighted that they have that local knowledge, local contacts, because I think the one thing I would say is we're hugely committed to partnership working, and it was really interesting to hear carers talk about, the support they got from MenCap and other charities. The voluntary sector offer is fabulous. It's just finding your way around it. So what we've always said in Hillingdon, and we're trying to do in Ealing, is that carers are fed up of telling their stories over and over again. They want one point of contact, and that we can then hopefully wrap the right services around them. And our third partner is Harlington Care. They are a regulated care provider, CQC inspected, and we've worked with them for many years. They deliver respite service in Ealing. I will absolutely echo what was said about it's the holy grail for carers to have someone to take over their caring role for a few hours, or to take somebody out. And Karen will highlight, the pressures already on that part of the contract. But it's a fabulous service, and hopefully does really give carers that break. I'm not going to go into too much detail, but there was just three kind of strategic points I wanted to really float with you, just so that you kind of got a sense of the benefits to the way we're working rather than just the actual direct delivery. So we are now trying to replicate what we've done in Hillingdon, which was the attraction of new resource into the borough. We've brought in 1.8 million over 7 or 8 years. We've just won our first little grant. So we are able to offer new services that aren't dependent on council funding. And now I have just tendered for our core contract in Hillingdon. I'm going to be prioritising some significant bids so that we can really grow opportunities for services. The reason we've been successful in Hillingdon is because we sit with carers and they tell us what's needed. So we have the evidence to back up funding bids. It's not easy, the funding is getting tighter, but I believe we can bring in some serious new resource into the borough over the next 12 to 18 months. So that's a priority for us. We're also part of the North West London Accelerated Reform Fund, which is a digital project from government funding to improve digitalisation, so enhancing our face-to-face services, looking at technologies to improve efficiency such as AI. Because of our relationships across North West London, I think there's a small resource going into each borough. It's being led strategically by an organisation called Bridget Care, along with our National Body Carers Trust. So we're looking at having a post, we're pooling small resources, and having a post across Harrow, Ealing and Hillingdon to implement some of the new technologies in Ealing. And then finally, I will let Karen come down to more detail, but the last piece of work just to flag is that I've been very involved in the development of 3ST, Third Sector Together for North West London. And whilst it's a little bit slow in the development, we now are nearly ready to go with a third sector impact framework, which we hope we can start to talk to commissioners and Ealing about. And that basically is an online tool that is very comprehensive. It empowers members to kind of take qualitative and quantitative measures and metrics supported by evidence, which helps the commissioning cycle. And we believe it can show the voluntary sector role in reduction of health inequalities, community wellbeing, value for money, and social and economic development. So that's just 3 pieces of work that are going on in the background that we're not necessarily contracted to do, but because of the way we work, we can bring to the table. So just very, very quickly, we offer respite in the home through Hollington Care, as I've mentioned, and we're looking at ways of stretching that money through perhaps collective respite, so group respite for people, so that carers can access some of the activities we have. We have 4 carer cafes. We've got new funding for the somatic coaching for carers. The team has developed a series of partnerships with NHS and other voluntary organisations, so there's a fabulous growing offer with other partners. So I'm going to let Karen tell you all about those, but as briefly as you can, Karen, without. Thank you.
Thanks, Sally. So I'm Karen Bonnick. I'm the service manager for Ealing Carers Partnership. There's not really much to add from what Sally said, because all the details in the handouts. But just to say that we started really delivering the service in March, and we're aware of that. There's over 24,000 carers in Ealing. It is very difficult trying to find all those carers, so we do like we've got a huge amount of outreach that we do. We've got an outreach worker, an engagement officer that's out in the community the whole week, and she goes into like community centres, places of worship all around the borough, promoting what we're doing. We kind of join any meetings that we get invited to or that we come across, just to kind of promote what we're doing. And it's kind of, as Sally was saying, and Kashmir, there are so many good services out there already, but a lot of it is just people not being aware of it. So we're trying to kind of pull it all together, create, we have a monthly newsletter that goes out where we try and get information about things that are going on around the borough that people that carer specific might be interested in. The respite is the biggest thing that people are asking for. And it's really difficult because we try and prioritise the people that need it the most, but every carer, even if they've got the person they look after goes to a day centre 2 days a week, there's still 5 days that they're looking after them. So they're still in need of some respite. So it is really difficult to try and prioritise who's being offered respite. With that in mind, we're looking at working with EHCVS, with the ladies that manage the volunteers there, Nadia and Whitley, to put together a pool of volunteers to be befriend companion type volunteers. They can make phone calls to people. Some of the people with the less complex needs that just might need somebody to sit with them and have a chat, so the carer can go out and do some shopping or something like that, could you know, be managed with a volunteer, because with Harlington, they're all qualified care support workers, to kind of pick up the people that have got more high level needs, where they might need help with toileting, medication, that kind of thing. So that's something we're developing. We're also looking at the group respite, as Sally mentioned, working with North West London NHS with the memory clinic there to do a joint offer of music therapy, 3-hour sessions every week. So that's something in the planning. We're hoping to get that up and running kind of March time. Also, we've involved Ealing Community Transport in that to be able to kind of manage the transport needs of people that can't get there. So that's something we've got in the planning. We've got the 4 carer cafes, which are around the borough, trying to kind of reach as many carers as possible. We've got 4 road shows planned for 2025, first one in May. They're kind of like a health and wellbeing road show. They were so successful when we did the Carers Week and Carers Rights Day ones. So we thought we'd do some more this year, because it was a, you know, really good way of getting different organisations to come present and kind of promote their services, and for carers to come and find out what's going on in the borough. So those have been really successful. So we've got 4 more of those planned. Yeah, lots more things. The somatic meditation, the coaching is going really well with the carers. There seems to be a real need for it, just kind of, you know, support carers with their mental health. That's been quite a positive thing that we've brought in, which is what we got the funding for. We also work with Mint. We have a weekly group with Mint in Hanwell at the Dig. So that's an area where they're funded by Cultivate London, and carers can come there, just somewhere to sit and relax in nature. There's gardening, people can grow their own vegetables and take home and things like that. So that's another nice thing. And we're looking at doing some art groups there when the weather's a bit warmer. So yeah, we've got a few things planned like for this year. And again, it's just keeping communication out there for the carers, making sure that we're linking in with all what's out there already, kind of working with partners and other voluntary sectors and statutory services as well, and, you know, just being a point of contact for carers, really.
Right.
Can I just finish on a plea? The data sharing issue is a big one for us, because with you setting up these services, and we're having to start from scratch to build up a carer register, and with the best will in the world, that's a slow process. So we've tried things like putting adverts in social service newsletters, but I think strategically it's worth thinking about if contracts for third sector organisations, or indeed statutory sector organisations, move around, how data can be shared when it's in the interest of those carers to do so, really. So that's been a challenge for us. But anyway, just that's all from us, and we'll now take questions. Thank you.
Right. Thank you very much. We'll take that back in terms of the sharing of information. All right, we'll open up to questions. I'm conscious of the time. My timekeeping hasn't been great. We've got half an hour left, and we've still got quite a few things to talk about. But Polly, do you want to start the questions?
Yeah, again, I'm not going to ask a question. I think it's really, really comprehensive, the whole report, and the piece of work has been really fundamental. And Gule and Sadaf, thank you so much. You know, it just like it's unbelievable to hear your experiences and your voice. You know, we sit here and look at reports all day, but listening to you talk about how the difference it's made to your lives and to be alleviate some of those stresses of what you do day in, day out is really phenomenal. And I would just thanks so much. It means everything. And I hope it's you know, it really does allow us to make better decisions and to do things that you need rather than the things that we as a system think you need. And it's really, really valuable. So thank you for your time. I just wanted to say, having been down to the Ealing Carers Partnership, it's really evident that really good work is gearing up, and we're great to be able to learn from your experiences in Hillingdon. I just want to commit as the portfolio holder to supporting the amplification of that work, particularly, as you say, finding finding people to support them into finding you, so that more people know about the work that you're doing. So perhaps we can take that as an action to see what we can do. So obviously we've got a fair amount of communication channels, but also that we're really making sure that all of our frontline service staff are aware of what you do and that they can be referring people into you, and just so that we're making sure we're making the best of all of those opportunities. But a big thank you from me to all of you.
Thanks, Wally. Chris.
Thanks, and I promise I'll be brief, so I won't repeat what Councillor Newstep has said. From a West London Trust perspective, I also really welcome the allusions to some of the work that happens in relation to our community mental health teams, and also wanted to commit to our work for mental health and community services around working with carers. We're signed up to the Triangle of Care programme and trying to get all of our teams and services accredited to that Carers Trust initiative. I am aware that we have a trust-wide Carers Council that helps to scrutinise and comment upon our work with carers, and I'd be really happy to make the connections with that and to commit to cascading any further information. I know that we do have a very active carers group for our community mental health teams in Ealing, and hope to expand on the learning and learn from others. So thank you.
Simon, I think you get a hand up again.
So really passionate presentations and really helpful to hear the feedback from you all. So much appreciated, and thanks for all the work that you do for those carers who also support people in and out of hospital as well. So you all do a fantastic job, and it's really important work. The one thing I wanted to comment though on the council report where it talks about the priorities, one thing that struck me was the comment around the NHS commitment to carers programme has identified that if you enter school with a health inequality, that health inequality will never close. Looking after young carers and supporting them to reach their full potential must be a key priority for all services. Don't need to go into it a huge issue now, but I didn't hear anything, and I'm not sure I spotted anything significant in terms of what might be being done to address that particular issue for young carers, and knowing one or two young carers, I know how important that is.
Thanks for pointing that out, Simon. I'm just going to pause here now. I'm going to allow Roy Willis. Roy has submitted 3 questions, but the 2 questions that are based around carers. Roy, if you want to just try and combine the questions into one and give the opportunity for Kashmir and others just to answer those 2. And the first question that you submitted will give you a written statement back around particularly in relation to dementia patients.
Yeah, thank you. I'm Roy Willis from the Ealing Reclaim Social Care Group. Yes, we submitted 3 questions last week, and I do agree that there are quite a lot to do with carers, so I can probably combine them easily enough. The first question is to do with a report produced by the Alzheimer's Society, the national charity, entitled "Because We Are Human Too," and obviously one of the things that stands out in that report is that older people who are dependent on social care to live at home, and also so some 50% of older people dependent on social care to live at home, and over 70% of older people living in residential care have got dementia. And despite guidance from the CQC and other bodies, only 29% of care and support staff have had any kind of training in dementia. So I suppose I could ask really what the carers group think, and also what other health and social care services are thinking about in terms of having an appropriate strategy and training to address this gap in knowledge, and so that those people living with dementia can have improved levels of support and care, which would further help prevent unnecessary panicky type hospital admissions, and also try and prevent carer breakdown, which is one of the factors that I'm sure you're aware of in the carers groups, that carers can become exhausted and fatigued and have to give up their role. Thanks.
Karen, do you want to just talk about the relationship with dementia concern?
Yeah, I was just going to.
Before we answer the question, Roy, you had a couple of other questions around carers. I just wanted to, because of time, I just want to make sure.
Sure.
If you can just give the salient points on the other questions around carers, and then we'll
briefly,
get the answer.
It was more about the care workforce, paid carers, about how the extension of the controlled parking zone arrangements, extending the restriction from 8 a.m. to 8 p.m. Is going to affect carers going about their work in the community, and really asking if carers and support workers should be given the same access rights as district nurses and other key workers who need access by car to those residential areas for their work on health and care and support purposes.
Okay, thanks for that, Roy. Okay, do you want to just come back in and answer the first question around the carer support for individuals with cognitive impairment and dementia?
Yeah, so I can answer that, Roy. So in Ealing, there's a very good organisation, charity called Dementia Concern. So we work very closely with them. So they refer quite a few people into us for respite support, and vice versa. If we come across carers that are referred into us and they need some dementia specific advice and support, then we refer them to Dementia Concern. So there is an organisation that does exist to support carers looking after people with dementia. We also work quite closely with the memory clinic. We get most of our referrals from the memory clinic, actually. So most of the carers that come to us are looking after people with dementia, because it's generally people with dementia that are the people that can't be left on their own at home. So those services do exist.
Thanks, Kashmir. Was there anything else you wanted to add before I bring in Polly around the parking situation?
Yeah, I just wanted to add that on the point around the school inequalities, so the strategy and the action plan are kind of like the sort of start of the process, and the action plan is sort of fairly high level, but all of this has been presented to Children's Services. I did a presentation there just a couple of weeks ago, and we're working very closely with the senior management team in Children's Services to now work out the detail of the action plan and how what actions we need to put in place to address those health inequalities and those inequalities around school attainment. So I can see Helen is on the call, and we've certainly had the start of what's going to be regular meetings to develop that action plan with Children's Services. And then just on the point of training for carers, that's also identified in the strategy and the action plan. We do recognise that, and that's come through our consultation, that carers need that support, they need that training to help them to undertake that role. And again, that applies to adult carers as well as young carers. So it's in there in the strategy, in the action plan, and we do work very closely with West London Trust as well, the SID service, who do provide some of that training. And also just to say that as well as the Ealing Carers Partnership, we do have the Carers Service as well, who are also doing work in this area.
I won't be able to take any more questions from the teams below with their hands up, but Polly, just the question around the parking provision, if we can just sort of close that one off and then we'll move on.
So this is my favourite question of the day, because I am delighted to say that in Ealing you can apply for, as an informal or professional carer, for a carer's parking permit, which costs £10 for the year, and that allows you 3 hours of parking in any of our CPZs with an identified resident that you care for regularly. So it already exists. I'm happy to share it with you, but I think it's really, I had to search for it. It's a really good example of where we can take advantage of our new relationships with the Carers Partnership and a kind of renewed commitment to amplifying and supporting the service that we do have, to make sure that that's a much more visible and known about service. Because I think we know that from some of our ASCOT indicators that carers don't feel it's easy to find out information about what is available. I think it's fairly clear from what we've heard today that there are a huge range of really, really good services, both council, NHS and within our voluntary sector. We probably need to get together and be a little bit more focused on how we can make sure they're easy and accessible for carers as they become carers and as they continue in that journey as a carer.
Thanks for that, and thanks, Roy, for your questions. I just want to finally say, within the JSNA, Kashmir, I did note the increased identification and coding of carers in GP systems, and that credit goes to Neha and the team at the borough in terms of the carer specification that we developed for general practice to promote the awareness of carers and invite carers for a carers health review, as well as the carers card across Ealing. So well done to our team in Ealing for doing that. Yeah, right, okay, I'm going to move on now, and we are now on item number 11, which is the Public Health Inequalities Fund Progress Update. And Ruby, you're going to very, very swiftly give us that update.
Yeah, hopefully everybody's got the slide packs, which should be on the agenda. But yeah, just over the next couple of minutes, I won't take a long time, just to kind of summarise the Public Health Inequalities Grant. So this was a pot of about £400,000 of non-recurrent funding. It was an opportunity for officers across the council to work with partner organisations to put in for projects and initiatives to improve public health outcomes. And we had 2 grant rounds and 6 projects were selected. And just over the next couple of minutes, I shall talk to 5 of them before handing over to colleagues at Ealing CVS, who will pick up the last one. So the first one to mention is the development of the Alcohol Partnership Group. This was a multi-agency group, and this has started in August. It was a grant of 100,000 that went here, and the purpose of this group is to tackle alcohol-related harm, crime and disorder. And this partnership group includes work with business improvement districts, residents associations, and also voluntary sector. And I've just highlighted here a couple of the key outputs, which includes premises being tested for underage drinking and proactive licensing visits, as well as some really fantastic community engagement events by HeartLink. This is really an important area for us because we have also very high alcohol hospital admission rates, and also really important focus on young people and underage drinking too. The next grant went to Trading Standards, who had an initiative to tackle the sale of vapes to under 18s. This is nationally and locally becoming more of a public health issue. The recent health-related behaviour survey showed that 10% of secondary school children have ever used or use vapes. So this is a really important piece of work, and there's lots of work going on here. I'm kind of highlighting a couple of key things, which were again colleagues testing premises for underage sales, and further community engagement events as well, which have been led by HeartLink. There's also the development of posters with the community in schools, which will enable both public and pupils at schools to report any kind of underage sales in an anonymous way. The third one I'm going to mention is the oral health outreach event. So this is a really fantastic initiative whereby communities and children and families have the opportunity to engage with dental services and also other children's services in areas where there's probably less engagement. So I think we've had nearly 800 children have received dental checkups and so far 11 outreach events. And this was built on a pilot from last year whereby about a third of the children who were engaged, when they did have their dental checkup, a third had a kind of red or amber rating in terms of they needed to see a dentist or needed some urgent review. And again, this is also another kind of key public health area in terms of being we're red on the indicators in terms of this is quite an important thing. So the next grant was again a relatively smaller grant that went to the Cultural Education Partnership that collaborated with 3 art-based organisations, and this project was called 121,000 Creative Minds, and a really inspiring title because it kind of relates to young people, the number of young people in the borough and the opportunity they have in terms of improving mental health. So there were some 8-week workshops that were delivered here, and I've just put a couple. It's very hard to kind of just summarise some of the outputs of this, but just a couple of quotes from the young people who engaged in this on the slides, and everyone who participated felt it had a positive impact. The last one I'm going to mention is the 5 Ways to Wellbeing project, this project was funding for smaller voluntary sector organisations to co-develop with different communities the 5 Ways to Wellbeing, which are 5 Ways to Wellbeing is a population type of mental health approach in how things that people can do to improve their mental health and well-being. And we had 5 organisations which had these small pots of money, and they hopefully you can see on the slide pack some of the outputs and some of the posters and creatives that were co-developed with these communities to translate some of this to have some impact. Lastly, I've just got the kind of wealth of officers who've been working across the council on these projects. And the last area is Ealing community and voluntary sector, and I will go to Ian, who's on the call. Ian, grateful if you can talk to the funding that went to Ealing CVS.
Yeah, thanks very much. I'm aware time is marching on, so I'll just quickly go through some of the highlights. So basically, we're working with focusing on specifically underserved communities, minoritized communities. There's a lot of, as we've heard, those communities in Ealing, looking to create sort of partnerships that help build the long-term strength of those community groups, to help those communities in need, establish a network for those community groups and members of those communities to come together to work more closely with the statutory sector, and in that way try and reduce some of those health inequalities, increase the capacity of some of those smaller groups to be able to meet some of those needs around health, and sort of have those better collaborative networks. Rationale being that sort of those marginalised community groups are less likely to have sort of contact with the NHS and statutory services and get some of those key health messages across due to some of those barriers. So we've been able to establish a regular network meeting every couple of months, having that better flow of information between NHS, 200 actively engaged members. Key topics have been things like TB, discussions of the health and wellbeing strategy. As a result, for example, the TB presentation, a group engaged with the TB testing van, and they was able to test over 40 residents on a rainy day. Ealing has quite a high rate of TB, I think, compared to nationally. And also the sessions have been able to have sort of discussions around some of those potentially taboo topics around, due to cultural differences, which are not always easy for different communities to discuss. Other presentations have been around things like Recovery College, Recovery Intervention Services, and these network members have been able to pass information on to the sort of the grassroots level of the community. Other areas of work have included around the Violence Against Women and Girls initiative. We've also done a training needs assessment analysis, seen some of the training that some of those smaller groups, community groups needed. And as a result of that, we've had sessions around leadership in the community, diversity and inclusion, unconscious bias, etc. 15 workshops, 80 plus organisations trained. We've had very positive feedback around the network. People really have been happy to engage and get that feedback. We've also done research around the areas that most need, and we found Northolt, Southall and Perivale were particular areas of need. And so because of that, we've been reaching out with outreach sessions, 2-hour weekly sessions every week, using Acton Library, Northolt Library and Southall Library. So this has meant groups or communities from those areas have been able to go access one-to-one advice around group development, improving the quality of their grant applications and helping them establish new groups. And so, for example, we've got £35,000 was secured for 2 minority networks groups. New group supported registration include the Caribbean and African Collective in Ealing, registered as a CIC community interest company. Also offer things like organisational health checks to help groups become stronger, more robust. Supported road shows, targeted monthly newsletter to over 200 subscribers without some of those community events. Partnership development is ongoing, supporting more partnerships to be come together to apply for more funding, roles around strategic representation as well, getting members onto health and wellbeing boards. So I think the outcomes have included things like increased community collaboration, enhanced awareness amongst those hard to reach, all those communities around particular health issues. New skills being developed. We've also worked closely recently on Ealing Roots and Wings grant programme, specifically a small grant for sort of Black-led minority organisations, and through that network we're able to engage with some of those most in need groups. £5,000 might sound a lot, but it can go a long way for a particularly small local group. And yeah, that's basically it. Thanks.
Thank you very much. Ruby, is that the end of your part? Yeah, great. Any quick questions for Ruby? Irfan?
Not a question, just a little update on the Roots and Wings grant programme that closed today, and there were 37 applicants for that funding. So it's a really excellent outcome for organisations that have been able to apply.
Great. Just one question, Ruby. In terms of the Inequalities Fund, just in terms of the number of years, is that in terms of the funding, is there what's the sort of the time envelope in terms of the entire funding? Is it I can't remember.
Yeah, so it was a non-recurrent pot. However, when the funding has gone to different grants, their actual usage of that is some of the projects have been within a year, some of them are taking 2 years. 2 years, yeah. So it's slightly variable, but it's in the rather longer report in the pack.
All right, thanks. Great. Okay, thank you very much everyone for that. Let's move on. JSNA annual report, chapter due in 24-25. Rajiv is on the call.
I am, Chair. Thank you. So I'm very conscious of time, so I'll keep it very brief and concise. The aim of this report is just to provide an annual update to the board on the joint strategic needs assessments. JSNAs, as we all know, alongside being a statutory requirement, is a key piece of work to understand the health needs of our population and inform commissioning decisions. So at Ealing, we have a rolling program of updating the chapters, the JSNA chapters, on an annual basis, and this is determined by a JSNA steering group, which comprises of representatives from all directorates of the council, our wider partners in the health and care system, as well as the community and voluntary sector. So the chapters are updated on the basis of a small set of prioritization criteria, which look at if the topic is something relevant to Ealing. For example, are we an outlier in terms of the prevalence or severity of that health condition, or if there's a specific inequality that we need to address. Secondly, if the key priority is that topic, that chapter is a key priority for the council or the wider BBP. For example, if you are developing a strategy for that area. Certainly, we look at if the chapter will produce some actionable recommendations or evidence that can inform how we deliver our services better. And finally, of course, we can't do anything if we don't have the resource. So that's also a key criterion in determining which ones we do. So a quick update on what we did last year. Kashmir and colleagues just presented the Carers GSNA chapter. So that's been done. It will shortly be published on the Ealing Council website and also on our data platform that's called Ealing Data. And the other chapters that are in progress, almost near completion, are a special educational needs and disability chapter, one on tobacco control, another on work and health, and two others looking at diabetes and asthma. And in terms of the plan for next year, we have coming up a chapter on dementia, autism, an inclusion health group chapter looking at the needs of asylum seekers and refugees, and a couple of children-focused topics such as immunizations and oral health. So, of course, we run an annual prioritization exercise, which is just coming up next month in the middle of February. So we will confirm the work plan for the year coming up, and looking slightly further out in the next year. If we can't accommodate a chapter in this year, then we'll put it on the plan for the next one. So yeah, the chapters are produced by relevant subject matter experts and data analysts, and then they are signed off by the GSNA steering group, and they will come here to this board for information before they are published. So yeah, I'll stop here and take questions, or maybe pass over to Anna for any further inputs. Thank you.
Any questions for anyone? No, thank you very much for that. Just something that we need to take outside, and is in terms of the support and contribution from the ICB in terms of the JSNA chapters, because obviously the organisational redesign, we know we haven't got the capacity that we used to have when we were an Ealing, Ealing team with a bigger clinical portfolio. So it's something for us to take out how we can manage that going forward. Right, okay, let's move on. COVID lessons learned, update and recommendations. Anna.
Hi everybody, can you hear me, BJ?
Yeah.
Yeah, great. So I've got a 5-year-old watching television in the background. So I've shared the report. It's been a massive amount of work the last couple of days across the partnership. I think the main thing to have a look at is the cover sheet really summarises it. And then we've got the line-by-line update as an attachment. I think there's some really good, really positive progress. I think between this and the health and wellbeing strategy, it's really helped us push in a certain direction, especially with our partnership work around inequalities, thinking about where we want to direct our funding. And working really well, especially with our EHCBS partners. So there's a number of themes and kind of things that have really moved forward, I think, listed out in that cover sheet that came up time and time again. There's a couple of small, very practical actions to take forward, still a lot of which are going to be under the multi-agency pandemic plan in the next couple of months. But otherwise, it feels like we're mostly there. Thanks, Vijay.
Thanks for that, Anna. That was really comprehensive and swift. Good, thank you. Any questions for Anna? Right, okay. So, and then finally we have the health determinants research collaboration, and Vice has just joined us.
Hi there.
Welcome,
Hi
Vice.
everyone.
I don't know how quick you want me to be, within a minute, or if I have a few more. So I think you've got the documents, which was a very high level overview of our progress report. We have a more detailed progress report, which we've submitted to NIHR. So for those of you who don't know about the collaboration, it's a £5 million 5-year grant from the National Institute of Health Research to build our capacity in local government to do research on health determinants, or the building blocks of health. We're one of 30 across the UK and 1 of 4 in London. We're working with academic and community partners, including IDS Imperial, LSHTM, we've got ECVS, who are partners with us, GoSAD, Southwark Community Alliance. And just to say, I mean, it's a 5-year grant, which is fantastic, but there's strong hints from NIHR that there will be a recommissioning process, and they intend it to become a permanent part of NIHR kind of infrastructure, like the academic research centres. So that's kind of good news, and it kind of gives us a lot of I think we're taking this kind of slow. We kind of recognise that this is a program that can give us some depth in terms of building that kind of research capacity, which feels kind of countercultural in this climate of funding shortages and a tendency towards quick fixes. So our ambition is that by strengthening shared learning culture across, that will contribute to making the work of colleagues in local government, academic and community sectors more impactful in promoting health equity. And central to this is a collaborative approach. So as you could see in the highlight report, we've really focused this year on building that collaboration, taking a really relational approach, tried to build a shared understanding and ownership of the project. So this year is fairly foundational. So a lot of the work is kind of invisible in terms of recruiting posts, building the governance arrangements, signing the partnership agreements. But a few kind of more exciting things are on the horizon and are about to sprout up. So the Community Action Research Initiative, which is building a sustainable community action, participatory action research infrastructure. So 27 community researchers across Ealing's 7 towns have been recruited, and they've started their first training session last week. And that will yield a lot of interesting insights, which we can talk about another time if you want to come in and explain more detail, or to the various partners. Another useful bit of work this year is a research project from London School of Hygiene and Tropical Medicine around the cultures of evidence in local government. So they've done some in-depth kind of ethnography interviews within Ealing Council, and that is hoping to shape our training and capacity building plans this year. So I think you could see some of the progress and the successes, but also the challenges, particularly the capacity issue. So next year we're really focusing on, or this year we're focusing on building the HDRC team. So we've got several new, I think 7 or 8 new posts that we're about to recruit in the next few months. Seeing this or nurturing this community action research bit, putting our headspace into thinking about evaluation, this first phase evaluation, and then also piloting a sort of early training development offer with early adopting teams in the council, as well as with the voluntary sector. So yeah, lots of work going on.
Great, thanks for that, Vaish. And I know in terms of when the applications went in and how competitive it was in terms of getting a grant, and Ealing Council were really successful. So we welcome you to come back and give us a little bit more information on how things progress in terms of that, all the work around research. That's excellent for Ealing particularly. Right, okay, where are we now? We are at the end of our agenda items. We are 3 minutes past 4, so apologies for running late. Our next meeting is on Thursday, 10th of April. So thank you very much for everyone's contribution and efforts in our board meeting this afternoon, and I wish you all well.